Welcome to the Community Health webinar series for November 2016. Today's webinar is Evaluation Planning. Today we have two speakers who are going to share information with you. Our first speaker is Stella Siwan Zimmerman. She is from ACET Incorporated. Great Plains Tribal Chairman's Health Board has partnered with ACET to evaluate programs funded by CDC and to provide evaluation technical assistance to sub-awardees. ACET is a business with over 17 years of experience evaluating programs focused on improving community health. The ACET team employs a variety of evaluation techniques that are culturally tailored to meet the needs of stakeholders. ACET will introduce topics of evaluation, what it is, why do evaluation, and how sub-awardees can use the information to improve programming efforts. Along with Stella on this presentation, we have Eugene Gallego, who will present with Stella. I asked Eugene if he would like to do an introduction and seems like we're getting background noise from somewhere. If you guys can please mute your audio on your phone or computers, we would appreciate it. Okay, so without further ado, I'd like to give the presentation to Stella and Eugene.
Thank you, Deverell. Well, for those who do not know me, I am Eugene Gallego. I am the program coordinator for Good Health and Wellness, and I assist 11 sub-awardees within the Great Plains region. For those who do not know, the Great Plains region is North Dakota, South Dakota, Nebraska, and Iowa. Typically, everyone would see me hosting the community health webinar, but for the sake of this presentation, I asked my good colleague, Deverell Yellering, to facilitate the webinar today. So this is just the agenda for what we are going to go over. The overview of the Great Plains Good Health and Wellness sub-awards, and that will be the funding, and several of the project requirements. And we will also be covering evaluation feedback, and those could be why is this important for tribal communities. So the way that we see it for tribal communities, feedback can be used to learn how project activities impacted people in the community for what adjustments can be made to strengthen their project. For Good Health and Wellness, for Great Plains Good Health and Wellness, feedback is important to also understand what policies, systems, and environmental changes are made, and how those PSE changes can influence the communities through sub-award projects. For CDC, the feedback is important to understand how a grant like Good Health and Wellness can make a difference, improving overall community health. It also helps CDC show their fundings and having an impact for tribal communities, and it gets an opportunity to advocate for additional funding to help eliminate health disparities in the American Indian population. Also, I'll be having Nicole, who also helps with the Great Plains Good Health and Wellness program. So if at any point, if I'm missing anything, Nicole, just feel free to join in and touch on certain topics. And we'll also be touching on the evaluation planning process and the next steps. So with the Great Plains Good Health and Wellness sub-awards, the funding is, like mentioned before, is a 5-year, and it's for preventing chronic disease. The project requirements that we have for the Great Plains Good Health and Wellness is meet with the Great Plains Good Health and Wellness staff to review project work plan. A lot of people I do work within the with our tribal partners, and that's meeting with just going over what it is that we're asking for all tribal partners to provide whether that's the community action plan, the scope of work, certain types of budgets that we help assist with. Also, share project successes and lessons learned. What we did provide annually is the symposium that we help with tribal partners. This year was actually a good symposium, and it helped a lot of the tribal partners learn from each other and gain more insight. I felt that this was pretty useful for tribal partners to engage and create more sustainable PSE change, just learning from each other. Also, participating in peer learning calls and any scheduled calls with Great Plains staff. The peer learning calls is also something that we utilize, which is the community health webinar series, what we're on right now. What we ask for all of our tribal partners and sub-awardees is that they do join at least 2 within the fiscal year. And anything that we do provide could be requested from all tribal partners. Participate in project evaluation and training activities, and submit progress report by the end of the project period. And this is always due August 31st within any fiscal year. So what is evaluation? Evaluation is the process of obtaining feedback to better serve the people impacted by your project. Processes include developing, which is the evaluation questions. What do you want to know? And it could be tailored to an evaluation statement. And this is more of like what this knowledge is, why this knowledge is important. And for the most part, within our evaluation plan template, we do provide, you can either go with an evaluation statement or a question, and it's always 2, but you can always add more to that. And the targets, what you hope will happen as a result of your project. Data source, what information is used to report on targets, and the person responsible, as well as the timeline. So this is like who will collect the data and when.
Thank you, Eugene, and thank you, Deverell. I really appreciate the introduction and talking a little bit more about the sub-award and the importance of evaluation from multiple lenses. And so the question becomes, how does evaluation work? And when thinking about how evaluation works, it's really capturing the journey of your project for the fiscal year. So how does your project unfold? What are some of those key activities, and how do those activities or PSC changes made an impact on your tribal community? And often evaluation involves feedback from others because you're trying to get at information from other people who are impacted by your project, whether they're individuals that attended your training or they're part of your tribal advisory committee providing feedback. It could also include project staff and partners, those individuals that supported your sub-award project. And also it honors cultural values and beliefs that are important for your tribe. And then it also acknowledges and applies to the community. And that's really following the Indigenous Evaluation Framework that's developed by the American Indian Higher Education Consortium. So there are 2 types of evaluation. Often you'll hear the terminology process-based, and then other times outcome-based. So what are the difference between process-based and outcome-based? I'll go ahead and start with process. Process are usually things that are focused on an activity or a task, like you're gonna have 4 meetings with your TAC, your Tribal Advisory Committee, or you're gonna implement 5 workshops for your project. So it's really about whether those workshops or those meetings occurred or trainings occurred. In this case, you're tracking information like attendance, meeting minutes, how many meetings held. And process-based types of evaluation tends to be easier to report and track because it's pretty, you can go, okay, I can see how many people today we have, let's see, we have 14 people on this call. So it's easy to say and report how many people attended and meeting minutes. Outcome-based, however, is different because it focuses on the results of your meeting or the results of your workshop or the results of the training you provided. So how did that training, it's really taking it to the next level. How did that training impact the people who attended? So did they gain some new knowledge that you wanted them to gain? Did they find the information helpful? Are they planning to use that information to make PSE changes in the community? Now, with outcome-based, it measures really the impact or the effects of your activities. And often they're harder to report and track. And it does take time to do that. So let's go ahead and take a look at the funding categories. Some of you would be where it will be the first funding category where you're developing a community health assessment. Others may already have a community health assessment in place, and now they're developing a community action plan. Maybe some sub-awardees already have a community action plan, and as you move into year 3, you're implementing policy, systems, and environmental changes. In that case, you're at the third funding category. So how does what I mentioned earlier, process evaluation versus outcome evaluation, fit into these funding categories? Well, when you're developing a community health assessment, it's very likely it's at the beginning stages of your project. And your evaluation is really going to be nearly all, if not all, process focused, like how many settings did you collect information, how many TAC meetings, how many members attended meetings. So it's really reporting on that process. Now, if you're already done with that and you're on community action plan, your evaluation is more process, still more process focused rather than outcome. So in this case, you might have things like you want to know whether the community action plan you just put together with your tribal advisory committee, your TAC, is something that's going to be supported by the community. Are these the right strategies based on the community health assessment? So again, it tends to be process related. Now the third funding category, all the way over to the far right, is about implementation. At this stage, if you are there at PSE implementation, your evaluation plan will be more outcome focused because it's not necessarily about the activities. It is about how those activities or changes made a difference in your tribal community. Now,
for the next steps for evaluation is developing an evaluation plan. For the most part, you'll see Great Plains Good Health and Wellness provide that evaluation plan template, and it is due 60 days after the first disbursement. So with a lot of our tribal partners, they are in the process now of receiving their funding, so they'll fall into this period within the 60 days. And also within that evaluation plan template, we are asking them to list 2 to 3 evaluation questions or statements and identify the potential data source and set targets. Also identify the persons responsible for collecting the data and the last timeline for the data collected. For the Great Plains Good Health and Wellness, we can provide one-on-one TA, and that is through conference calls or video webinars. For the most part, we have provided this TA for some of the tribal partners and sub-awardees, and the persons responsible for this call is usually me, Stella, or any of the whole ACET team. Am I saying that right? It's ACET, right?
ACET.
ACET, okay.
ACET, yeah.
Yeah. So we'll also do through reviews of initial drafts and feedbacks. For the most part, we do send a lot of our drafts and feedbacks, and if they do want a conference call, we can provide that. For the most part of this year, we have been providing video webinars, and we found that that was more helpful in providing our TA within the go-to meetings sessions, because it also gives a chance for us to provide and show like visuals of how we would like our evaluation plan completed, and any kind of technical assistance that any of our tribal partners have, they can have that visual and we'll have that visual as well. Also through sharing additional samples or resources by email. there was instances to where we did provide different types of resources for question feedbacks. So we're able to provide any kind of those kind of resources or whatever it is that you were requesting. Stella, is there anything else that you would like to talk about on this?
Yeah, often, thank you, Eugene. Often we get a question when we do these evaluation webinars is, well, we put together an evaluation plan for year 1. Do we have to do one annually for year 2, year 3, year 4, and year 5? And the answer to that is that the evaluation plan is an annual evaluation plan. Unless your project, what you said you're going to do for your work plan, did not change from year 1 to year 2 or year 3, then it's likely your evaluation plan may be just tweaked slightly or maybe no change. But if year 1, you're doing a community health assessment, then your plan is focused on the community health assessment. But if it's year 2, you're at developing a CAP, then your evaluation plan will need to be developed based on what you want to know about your CAP. And then year 3, if you're at PSE implementation, then you'll need to revise your evaluation plan on what you propose to implement as your PSE strategies. So I'm going to go ahead and show a little bit more what that might look like, as many of you are now approaching year 3 for your evaluation planning stage. Eugene, anything else about that before I move on to the next one?
No, but I do feel like a lot of our tribal partners and sub-awardees do have a lot of these kind of questions. So, and there might be more questions that do arise. So if there is any questions at all, just please go ahead and ask them at the end of the presentation. We could touch more on that. So.
Okay. All right, so another question, and I'm going to go ahead and show a template. We have, as one of the resources, is a template. It's a template that you can use. It's a Word version, and it's ready to be typed. So you could use this template the way it is and go ahead and type the information that Eugene mentioned, like what's the name of your project, when did you put this plan together, when it's revised, what are the goals of your objective or your project, which can be gleaned from your sub-awardee application, and what are some of the questions or statements, what are two or three. So this template includes room for 2. And let's just say you want to have a third question. You can certainly copy this template and paste it in, so there'll be another set of rows here. So there's space for writing what your data sources targets are, person responsible, as well as schedule or timeline. So let's see what this looks like. Many of you are, as you approach year 3, are done with your community action plan and are beginning to implement those things that are listed in those interventions that are listed in your plan. So this is just an example of what that might look like for PSE implementation. So this example is that a sub-awardee may be interested in knowing they want to do healthy eating as part of their intervention. That's what they found through their community health assessment. And they want to know whether the intervention is going to increase the number of students eating 3 servings of fruits and vegetables a day and taking place in school setting. So the 2 example here, there's actually 3 example evaluation statements. The first statement is, we want to know if eating healthy is important to students at our school and their current consumption of fruits and vegetables. Again, the statement or question links back to the goal. And in this case, this sub-awardee might be interested in, well, to find out what their students' current consumption is for fruits and vegetables, let's survey them. So then your data source would be a student survey. And the person responsible, then you would list somebody at your agency that would be administering that student survey. And the timeline here is, you might want to specify a specific date. We're going to do this student survey January 2017. You can certainly put a date there. Or if that's unknown at this time, you know it's sometime in the spring, you can also put spring of 2017. Or you can put before the marketing plan starts if you don't necessarily have a specific time frame quite yet. The second evaluation statement example is, we want to know if marketing healthy food choices will increase the number of servings of fruits and vegetables students eat. So another data source could be, you want to make observations, doing school mealtime, whether it's breakfast and lunch, and visually count, are students choosing fruits and vegetables as part of their meals? And the person responsible could be the same person, could be another person, or it could be, if you have a volunteer from your TAC, they might be interested in being part of the evaluation efforts at your community. So then the timeline would follow the same, if a date is known, go ahead and put your timeline in there. The third example I like to highlight is this one, which is we want to know if marketing efforts are influencing what students eat, doing, and after school. So again, here, since you already did a pre-survey, you could do a post-survey at the end of your marketing efforts to find out what the students say. How many students said that they eat fruits and vegetables on a regular basis, and how does that compare after your marketing efforts or your intervention to get more students to eat fruits and choose fruits and vegetables? So that's just one example, focus on healthy eating. And we can certainly, as Eugene mentioned, provide evaluation technical assistance as you develop your plan with your TAC that would meet the needs and be something that's doable. Because sometimes you might look at an evaluation plan and go, wow, we're not, there's, all these pages, 10, 15 pages. But when putting one together, we're really recommending that you look at maybe 2 to 3 statements and focus on 2 to 3 things you want to measure for the year. By all means, if you want to do more than that, you certainly can do more than that, because this is flexible enough to do. So in this toolkit, we also have some example process questions and outcome-based questions. And the left side of your table shows what a question may be. And then the right side would be an example of what would be a statement. So if you were to translate the question to a statement, what does that look like? And usually evaluative statements are in line with the Indigenous evaluation framework. Rather than just putting it as a question, it's more personalized, and it's really looking at what you and your tribal advisory committee want to know about your project. So if it's process focused, the question may start with something like, how are key activities implemented, or were they implemented as planned? And then the statement would be really, again, internalizing this, and we want to know how our project unfolded and what adjustments were made. So that would be an example of how a question could be written as an evaluative statement. And then, did our project serve people whom our project was designed? Another way of looking at that is we want to know who participated, and we want to understand the experiences of those who attended your event or workshop. So outcome-based, so again, in year 3, 4, and 5, we're really kind of looking at more as you write your evaluation plan, especially when you're at PSE implementation in year 3, 4, and 5, looking at more outcome-based. How did those interventions make a difference? And so here are just 3 examples of how a outcome-based question can be an evaluative statement. Like, you want to learn about PSE changes made to better your community. You want to learn how people from the community benefited. You want to learn about successes and challenges and how this project can be improved in the future to better serve your community. Now, after you develop your questions, you put that in the first 2 rows. Rows. Then comes, okay, what are your data sources? How are you going to measure that? And often you see words like quantitative and qualitative. So what's the difference between the two? Quantitative, think about it like you're going, like, to say you're checking out at the grocery store, and you get your receipt and you look at it, you buy 3 apples, and you'll see the price of apples times 3. It's usually associated with quantity, things that you can count. Sources could be like number of people attending, count of material share at the event. Maybe you're having a health fair. As part of your health fair, you have materials you develop that are really focused on healthy eating. And you want to know, are people interested in this? Are they picking this up? Are they looking at it, asking you questions? And are they going to take it and apply it once they get back home or get back to their work site? Qualitative. So the count gives you how many people pick up the materials, right? but it doesn't tell you necessarily the how. What did they do with it beyond they might ask you questions and tell you at that point. But when they do tell you this, it's qualitative data because it's things that are not easy to count, but they are things that are really important. Like they can share with you an experience of how traditional dishes or how they can use the menu options or educational materials to improve healthy eating at home. So they are sharing these things or their observations made or interpretive information. So it's really the things that you're hearing that are stories that are really important that talks about why these materials actually made a difference and how it made a difference. And so it could include not just what people tell you, but it also could include drawings, photographs, as well as just through direct conversations through a one-on-one interview or a focus group, as well as open-ended items on a survey. So those tend to be the qualitative component of a data source. So let me put this in as an example. Again, quantitative versus qualitative. Let's just say you have a physical activity event, and you want to know whether the event met the people who attended your physical activity event, whether it met their expectation, whether they learned something new, and whether they used the information and it influenced their work. Well, you could just survey them, right? You can just write 4 simple questions. Did it meet your expectation? Did you learn something new? Did you use the information? And did it influence your work? They can say yes, no, somewhat, or they can say strongly agree, agree, disagree, strongly disagree. And then you can count up how many people said yes, how many people said no. So then you can report yes. Let's just say hypothetically the results came back and 80% said yes, it met their expectations and so forth. That's great and everything, but it doesn't tell you the how. So let me show you what I mean by that too. So let's just say you supplement your survey and go, or maybe don't do a survey, you want to do an interview. You want to ask people at the end of the physical activity training or event, how did this training influence your work? Well, it's open-ended and you get to hear people tell you. And so they might say stuff like, you know what, I learned about this, or I didn't know about this, and now I understand why it's so important to do this. Or they might be able to tell you, I was able to share this. I want to share this with so-and-so, and this is how I plan to do it. It gives you so much more richer information beyond 80% said yes, which is also important, but the qualitative gives you the how. They all point to the yes. Now, data sources, just to summarize, include observations, storytelling, surveys. It could also include registration or sign-in sheets. Rather than doing a separate survey, maybe you can embed that into your sign-in sheet. They can sign in that they're attending, and then maybe 2 or 3 questions that you really want to know about people who attended your event, and that could act as part of your survey, embedded into your sign-in sheet. It could include program records, just reviewing program records or audits. It could include interviews or small or large group focus groups, discussions. I'm gonna pause there and just check in to see if people have any questions before we dive a little bit more into the data sources.
If you have any questions for Stella, you can go ahead and write them into the chat box at this time. If you are on the phone, you can just unmute yourself and ask a question.
So one of the most common questions I always get when assisting providing TA for these evaluation plans is, why do we do this? Why is this important? It's important for us, Great Plains, and the ACET team is because we can assist, determine, and identify. We can assist the impacts of an evaluation. We can determine if we're having the effect that we expected. We can determine if we're meeting our goals. It can help us identify areas of program improvements. It can provide the information to share with community and funders, and it can provide justification to support future requests for funding and sustainability.
Thank you, Eugene. Because I know that's one of the questions that come up. I'm just trying to also think about another question that would come out is, how does the work plan differ from an evaluation plan, or a community action plan differ from an evaluation plan? So when that question gets asked, one of the things we talk about is, oh, we got another question, but I'll quickly summarize this one, which is the work plan, what you submit to Eugene or staff over at Good Health and Wellness is really about your activities, versus your evaluation plan is, how are you going to measure the success of your activities? Or how are you going to measure the impact of your activities? So your evaluation plan is really you can think of it as an extension of your work plan or your community action plan. It's okay, now you have these interventions you're selecting, you're going to implement these interaction. Then your evaluation plan is, okay, how are we going to measure the success of our community action plan or our intervention?
So we have a question in the chat box from Renee. Renee's TAC created a survey for an event, but she did not state how the event affected their participants. Will she need to add a how on her survey?
And that's that there are a couple of options there, Renee. That's a really good question. You could have some open-ended items on your survey to ask how. It depends on when you're going to minister this. If you're going to minister this, say, after the training or after the meeting, the event, then you can ask them, how do you plan to share this information, and ask it as an open-ended item. Another way you could do it is if your survey is, you don't have necessarily maybe room. Sometimes that comes with a factor. You want it only one page, but there's really not enough room to put 3 or 4 open-ended items. You might want to ask people before they leave to share, or maybe after they have implemented it or shared it, what they think about it. And in that case, you would just ask it as part of an interview. Anything else to add, Eugene, to that question?
No, I think you pretty much covered that part of that question.
And Renee also asked if she can put the how in the comments, or maybe like a comment section on the survey.
Yes.
One other thing that I've kind of noticed is that when it comes to the evaluation plan, it's kind of unique with every sub-awardee or anyone else that's doing the evaluation plan. It's kind of unique and tailored to the way that they're evaluating their progress or anything that they're doing. So everyone's different. So if you want to tailor it to how you want to do it, that's something that me and Stella could also provide TA and assist with that. So.
The next segment, we're going to, if it's okay, to now segment to the details of the data sources. I'm going to try to play my screen again somehow. I can't find it. Hold on a second. Oh, how do I end this? End slideshow. Okay. Let's see if I'm able to show it. Okay.
Whenever you're, yeah, there you go.
Okay, slideshow, oops, slideshow play from start. Okay, so this latter statement is, latter presentation is the actual data sources. I'm gonna show some examples of some questions. When you're looking at this, you may find some questions, that's not really important for us in our TAC. You might see this and go, oh, I like question 4. And please feel free to adapt this and use this that fits you and your tribal advisory committee and your community. And so basically what I'm trying to say is that your evaluation can take many forms. There's really no one size or no specific question that fits all. In thinking about identifying your data sources, think about your resources. How much time can you commit to evaluation? Is it something that's easy to administer and it gathers information you can use? And that it honors participants' time because they're giving you a gift of providing that feedback. And so being able to respect their time and then also honors their feedback because you're going to do something with what they share and be able to make adjustments or even be able to tell the story of your project and how that might look like in the future. So I mentioned earlier the registration form, and you can collect this before the event. You could, to understand more about who attend your event, you could have questions like, what interests you about this event? And they can check one of the boxes because now it's embedded into your registration form, and you can now use this to plan future events because you might want to go, oh, they came because of this. They came for that. You can also have another item in there that says, what interests you for future events, or if you want to know if people who attend your event currently use commercial tobacco products and if they want to quit. So the only thing about a registration form is exactly it. Registration forms are supposed to be very, very brief. So in some cases, it could be just a postcard size or index card size. In that case, you can't necessarily have a lot of room to ask a lot of questions. So if you do take this approach, think about it as if we were asked 2 things, what are they? Or else it becomes a survey. So a survey could be an event feedback form. Some of the things that I had mentioned earlier, whether the event met their expectations, you can do this as paper and pencil or as online with a link, similar to how we're going to demo that at the end of this presentation. And typically they should be administered right after the event, unless you're testing knowledge pre and post or testing something pre and post. Then you'll do it before and after. Excuse me. So I wanted to show a couple of different options here. So maybe you want to do a pre and post and you want to know how people pick healthy choices. So you can ask them how much they consume healthy choices on a regular basis and whether they agree with the following statements. So these are some examples of some questions you could have on a pre and post focus on healthy choices. I also have some examples here on tobacco policies. Maybe you're interested in knowing how you implemented some PSC changes that are focused on commercial tobacco policies, and you want to know whether they have taken that information and encouraged someone else, or that they actually saw signs on campus warning people, so environmental changes. And so in this case, you can ask people, did they see this before? Are they doing this before and then after? So here are just some examples of some questions you could have on your survey. And my second to last is the storytelling. And this one is a very important component of this, of the evaluation too, that you may want to also include in your evaluation, because it's the personal stories. And that would be, how to share that, how to find out more about how these changes impacted individual lives. So these are just some ways, once you get these stories, how to kind of find, write, tell, share, and report on those stories. So the storytelling itself too is actually a separate webinar, but I wanted to introduce a little bit more about how that could be a very important element of your evaluation plan data source that could describe the impact to people. Second to last is the focus group. It's usually done in a small group setting, and there's a facilitator, at least one facilitator or co-facilitator, similar to how this evaluation webinar with Devrel facilitating the session. So you can ask people directly, what did they enjoy? What would they like to see? And you can see in there these 4 sample questions, they tend to be open-ended. They're not yes, no, like, did you enjoy this event? Or, please fill in what you like to see. It's really asking people what. And so here, or how and so forth. So here you can really expand upon that sharing through a small group discussion like focus group. And then similarly, getting feedback, you could do it rather than a small group setting, you can do it as one-on-one, either done in person or over the phone. Similar, you're just asking them, what did they learn? In what ways have they shared the information, and how does it influence their work? Okay, I keep saying second to the last. I noticed I have a few more slides here. So I think this is second to the last, is the observation notes. And this one would be, let's just say you and your TAC decide for your year 3 evaluation plan, you know what? We don't want to do a survey because we just survey community members for our community action plan. We're going to be implementing all these strategies or interventions, and we want to observe that. We want to get a sense whether that is making a change. And so you could then use observation notes as your data source, like counting how many people attended your event, or did people seem engaged? Did they seem interested? Did they pick up the materials? Did they ask questions? Or it could be messages. What are the messages from your posters or your campaigns or your public service announcements? What are people thinking about those messages? And do people want follow-up, like more training or more technical support from your project, or maybe additional resources? And just basically overall impression, because in your progress report to Good Health and Wellness staff, there's an opportunity there to just describe what were your overall impression of the project. What did you think worked well? And what are some barriers you encountered? And that's all based on your observations. Okay, that was my last slide. Eugene, can you think of anything else to add about the data sources?
No, I think that's perfect, and I'm glad that you kind of touched on that part, because a lot of the people that are doing their evaluation plans, they are having trouble on identifying the types of data sources that they could utilize. So thank you for that.
Sorry, whoops, went too fast. There.
Thank you, Stella and Eugene. Is that the end of your presentation?
Yes.
Okay. At this time, I'd like to open the floor for questions. Anybody who has any questions for our presenters today, you may ask a question in your chat box. If you're joining us on the phone, feel free to unmute yourself and ask a question.
Stella, can you hear me?
Yes, I can.
Hello.
Hi.
Okay. This is hi. I was just gonna ask. See, when we created the survey, we didn't go as far as to think of the how, like you mentioned, but it's a really good idea, to get further input from them, to ask them that question. And so I'm just wondering if, we did it for this first event, but if we change the survey for the next event, would that kind of alter the data that we're collecting, the results? Do you think it'll alter it that much?
Well, it sounds like, Renee, in this situation that you're mentioning, thank you for your question, Renee. And I think one of the things is you're not necessarily altering existing questions, but you're adding some additional questions from either, so it's not necessarily going to change the question interpretation for pre and post. You're just now getting more information because you're adding additional information that you find that would be informative.
Okay, thank you.
I sent out the evaluation feedback form for our webinars. I sent the link to the chat box. If you have some time, please fill out the evaluation feedback form. The recorded presentation and the evaluation feedback form will also be sent out via email, so keep your eyes open for that. We really value your feedback and helping us make our webinar series better in the future. So thank you. We are still have the floor open for any questions that you may have in regards to evaluation for Stella and Eugene. If there are no further questions at this time, that concludes our Community Health webinar series for November 2016. Our next Community Health webinar series is scheduled for Wednesday, December 14th, and the topic of that webinar is Community Clinical Linkages.
Ooh.
Our new PSE health educator, Shannon Udy, will be presenting on that webinar. So we will also send out a flyer and calendar invite for the next webinar series, so keep your eyes open for that as well. So again, thank you all for attending the Community Health webinar series. Thank you to Stella and Eugene for the wonderful information you've shared today. I want to say happy holidays to everybody, and we'll see you at the next webinar. Thank you.
Thank you, Devereaux.
Thank you.